So for today, let's discuss a topic called as PE, also called as the pleural effusion. So pleural effusion, if I were to understand that, I wanted to imagine the parietal pleura and the visceral pleura, which are the covering of the lungs, right? And these coverings will host a space within them, which is called as the pleural space. Now within the pleural space, if there is too much of fluid, normally there is always 20 ml of fluid or 15 to 20 ml of fluid, and if the fluid quantity increases, then it will lead to a pathology. And if the nature of fluid is not what it is normally, then again we can define a pathology. Now let's talk about the different kinds of condition where there will be different types of fluid within the space. One is blood, that would be called as hemothorax. One would be pus, that would be called as empyema, if the fluid here is purulent in nature. Then if there is passive transudate, what is passive transudate? Passive transudate is basically when there is less protein, whereas there is more fluid, right? If there is passive transudate, that would be called as hydrothorax, and if there is chyle, right, then it would be called as chylothorax, and if there is serous fluid, it would be called as pleural effusion, right? Having said that, there are different mechanisms of pleural effusion, but more importantly, let's talk about the pathophysiology. Within a blood vessel, there are two forces which maintain the fluid compartment within the blood. One is the colloidal osmotic pressure or colloidal oncotic pressure, which is an inward force towards the blood vessel, whereas the hydrostatic pressure, which is due to the fluid, which is an outward force. Now, let's say within the lung vessels, if there is loss of protein, hypoalbuminemia, then there would be decreased colloidal oncotic pressure. Or if there is too much of blood, or if there is decreased circulation of blood within the lung vessels, then there will be increased hydrostatic pressure, right? We'll be discussing this in detail a bit later.